You know, there are some times where we just can't help everybody, and you know that's a given when you're dealing with people who have these chronic pain conditions, and they may have lots of other things going on. And so, for the people that we can't help after 4 visits, what we then try and do is find the right direction for them, and it just depends on what their symptoms may be. So, for example, some people can have a locked jaw, where the disc is completely out of position, and they could be completely pain-free, whereas others, it may cause absolute havoc for them. And the research shows that 95% of people can be treated non-surgically. So let's say we've tried treating them non-surgically. If that doesn't work, then at that point, I would refer them for an assessment with some of the local surgeons that we work with. That would be one scenario. Another person may be someone whose migraines, for example, may not have improved as much as we like. At that point, it may be, look, we refer you to a neurologist who also does muscle relaxant injections and follows a migraine protocol, because it may be something that they haven't tried already. Sometimes we may have some people where, despite our best efforts, because they've got a completely blocked nose, they're constantly just stretching their head forwards, and it's kind of undoing a lot of our work. So it's at that point we will say, look, perhaps we need to get the ENT to do what they need to do, and then see what else we can address from there. Sometimes we need to refer somebody to a dietitian, a nutritionist, so it just depends on what we feel is hindering the process, and that's what we try and do to take care of them.